let's talk about, somebody asked about EYP. So egg yolk peritonitis, right? Am I saying that right?
That's right.
Do you want to talk about that a little bit? I had a follower send me a picture of her chicken who they did they opened her up after she had passed, and she was just filled with egg yolk material that almost looked like it was dried and hardened, and it was very clearly what that was. So do you want to talk about that and how that happens and how maybe you can notice that happening to your chickens?
Yeah, sure. So egg yolk peritonitis will start at the back end, right? So if we talk about the cloaca, it's like Latin for common sewer. So you've got everything dumping in there. You've got the urinary tract, the digestive tract, and the reproductive tract all coming together in one spot. As a hen ages, kind of the valves don't quite work as well, right? And
Right.
so you've got the potential for bacteria to actually go back up into the reproductive tract. And that reproductive tract is a tube. It's an open tube into the abdomen. And so if we've got potentially bacteria in there, that's a way for bacteria to make it into the abdomen and potentially contaminate those eggs. So if there's any sort of, let's say she's got a stressful situation or an infectious process like salpingitis in the reproductive tract, that can cause the eggs that are dropping from the ovary to miss the infundibulum. So to go back a little anatomy lesson, the infundibulum is the very top of the reproductive tract. It's what catches the ova. It's in even, women, most species have that part of the reproductive tract. So sometimes those ova will not get caught, right? The catcher's mitt misses and they end up in the abdomen. Now that's not necessarily a bad thing. There's actually, there's mechanisms within the abdomen to absorb that yolk. It's totally normal. Actually, it happens relatively often. And there's some interesting studies. You can actually take sterile yolk material, because this has been studied, and inject it into the abdomen of the chicken, and they do fine. They have the ability to resorb that. It's basically good energy, and so they just pull it back in and then recycle it. But if there's bacteria in there, obviously yolk material and bacteria, those aren't a good combination. Bacteria can thrive on that yolk. So we see the egg yolk peritonitis more so as hens get older. And, there's really not a whole lot that we can do in terms of like trying to prevent that. Obviously, reducing stress and reducing infectious process, right? Keeping our birds healthy is really going to be the main approach that we can take in terms of treating that. And the other thing is that that's a really significant infection that, you mentioned the case just before we started on this one, was that, the owner found like a mass of infected material inside that hen.
Right.
There's no amount of antibiotics that are going to be able to clear that, because the blood supply doesn't go into that mass, right? And so while antibiotics may help temporarily, they're going to knock down the infection around it. It basically just leaches back out and starts all over again once the antibiotics are done. So it's really keeping birds healthy, keeping them not so stressed out. And that's going to be our best approach. And just kind of know that as birds get older, that's one of the things that are going to pop up more often is the peritonitis, egg yolk peritonitis.
Okay. And so when that happens to a chicken and that is the case, is there a treatment to like, okay, I'm going to fix this hen, or is it like, dang, like this got too far too fast?
Yeah, I mean, that's a tough one. One is that you really don't know exactly what it is, right? Without like imaging, and then even with, veterinary like radiographic imaging, it's still not great because I can tell you there's an eggshell in there, but it may be a mass, but then again, you don't know what that mass is. So you really, if that's the road you're going to go down, you need to be prepared surgically. And even then, you essentially have a giant infected abdomen, right? And so even in human medicine, that's one, like think about a ruptured appendix and how serious that is. You're spilling, intestinal material inside the abdomen. I mean, this isn't too far away from that because it's bacteria that originated from the intestine, and now you've got them inside the abdomen. So they're often guarded prognosis when that happens.
Okay. What is let's talk about water belly, and I can take us out to my chicken here. And my brother's trying to FaceTime me. He's probably reminding me about baseball practice today that our sons are in baseball together. I tend to forget. So a lot of people, when they see my dog is losing her mind, a swollen abdomen, everybody online is like, it's water belly, it's water belly, it's water belly. And you and I have talked about that it's not always the case, it's not always what's happening. And then people just, treat it like it is. And that's not really what they're dealing with. But do you want to talk a little bit about water belly? I kind of think mine might be water belly. You
Yeah.
and I have talked about her a little bit, and I can show you as best you can see on screen here on a live video on my front porch. But let's talk about that a little bit.
Yeah, sure. So there's really, that water belly gets wrapped into everything that could potentially have, swollen abdomen. And if we really break it down, there's two kind of causes of it. And the easier one that's reproductive related is just like humans and other mammals have two reproductive tracts, the left and a right. Chickens start that way as well. So
Okay.
always think about it as the left one gets left behind. So actually, the functioning reproductive tract in a chicken is the left side. The right is the remnant. So it really never develops. However, it can develop into a cyst, and we see that, and that's definitely can be breed related. Not always, but there is definitely a breed predilection. We see it relatively common in some of the more commercial breeds, and it's been selected away from it. It's still there. But what happens is that cyst grows over time and it turns into like literally like a water balloon. And it puts pressure on not only like the internal organs, but also those air sacs that are in there. So what you'll see is as this cyst gets larger and grows with fluid, puts more and more pressure, it's space occupying, and she just can't breathe very well. So
Mm-hmm.
she's kind of walking along somewhat like that penguin stance. And you can kind of see her panting more so when it's really maybe not hot outside, or she shouldn't be panting just because she can't breathe. She can't move enough air into those abdominal air sacs. And so we can use like short needle. And what I would suggest too, and we can maybe talk about this later when we're looking at your hen, is that most people don't have access to like really short needles. They're sort of hard to find. But like a 3/8 inch or even a 1/2 inch needle, 3/8 inch would probably be better. We're going to use
Okay.
that to drain her, and actually like an 18 gauge, so something's a little larger. You don't want to use like super small needle,
Mm-hmm.
but a larger needle. And if you don't have access to those short ones, an easy trick is every needle comes with a hub, like the plastic, not the hub, but the little sheath that goes over it.
Okay.
So you can take that hub and trim it down so that just the amount of needle that you want is sticking out of the end. And so you have like a little guide there. So you can pop that needle in real quick. And then it actually butts up against the sheath. And so you can only go that far, right? So that's a
Yeah.
nice little insurance policy not to go too deep.
Okay.
And if she's sitting, what I suggest is kind of your target is like 1 inch below the vent, 1 inch to the right. Because remember that cyst is on the right side.
Mm-hmm.
And so if she's sitting, you're going to go like parallel to the table that she's sitting on, right above the table, again, to the right to the vent and below it. And clear fluid should come out. So clear fluid,
Okay.
it's pretty much your sign of cystic right oviduct. It's just cystic fluid. It'll drain out. You don't have to draw it out. It should drain out naturally, especially out of that 18 gauge needle. Remember, that's a little bit larger needle.
Mm-hmm.
The other side of this is true like peritonitis. So that's driven by either heart issues or liver issues. So that's back pressure. So the circulatory system is trying to push blood either
Okay.
through the liver, and we've got a diseased liver, and now that serum is like basically getting forced out into the abdomen. And so that fluid is more yellow straw colored.
Okay.
We could also have sort of an infectious part of that too. You'll see, some hens like with Marek's disease, and they get tumors in the abdomen.
Mm-hmm.
That will produce fluid too, and often that's going to be a yellow serum, sometimes blood tinged fluid as
Okay.
well.
Okay. And so a lot of times people will say, like, how do I cure, water belly? How do I, how do I fix her? There's really no cure, correct? It's just kind of maintaining her comfort level as she's kind of dealing with it.
That's right. Yeah. So the cyst will come back, right? We're not going in there and removing the cyst. So the cyst is going to continue to produce fluid. And so
Okay.
we can easily maintain that one. They usually do well for relatively long periods of time. Remember, we always want to clean, before you put the needle in, we're going to sanitize that skin and make sure we're
Mm.
using a clean needle. But they can do fine, right? Ascites, which is
Yeah.
more of that serum fluid. Now that's
Right.
coming from either like liver disease or heart disease. And those can be brought on by a number of things, like mycotoxins in feed, for example, can cause liver issues. Marek's disease and other oncogenic viruses can affect that liver and affect the ability of the blood to go through it efficiently and cause that back pressure. So it can infections. That peritonitis can produce fluid as well too, right? That's just the immune system reacting to that mass that's in there and producing fluid. Those have more guarded prognosis, right? It's really not a whole lot we can do there. Again, supportive care, as long as the hen can manage and do well on her. She's eating, she's drinking, she's fine. But once they go off feed and they're not drinking anymore, that's really when we need to consider the welfare of that particular hen.
Right. Okay. Are there any questions that anybody has? If you want to pop them in the comments, if you don't have any questions, if you want to hit the little paper airplane in your bottom corner and send this out to share with other chicken keepers, we appreciate that. Or you can share it later into your stories. It'll be on my feed. We're not done yet, but I just wanted to shout that out there. Someone's asking about, I'm thinking that means broodiness, not bloodiness, maybe. Broodiness and somebody was talking about that water belly is stress related and you just need to feed the ravens and crows to keep the hawks away. I don't think that's going to stop water belly, but it's certainly not a bad idea to get crows around your property to help keep hawks away. Somebody else is asking about broodiness and silkies. I have 18 broody hens in my bantam coop right now, mostly silkies or silky mixes. I've got some cochin bantams in there that have joined the fun and Saramas, and it's just a pile. And they all think they need to be broody in a pile. It's just absolutely ridiculous. When I have a broody hen in my main coop, where my main egg layers are, I either give them a chick so they can be a mother, or let them hatch eggs, or I will broody break them to kind of stop the cycle. Because I have had hens before who will just sit there forever and their health just starts to deplete because they're not eating as much, they're not out foraging, they're not dust bathing, they end up with mites, and it's just kind of a mess. So any thoughts on that and health of chickens? I've had a few questions I've seen in the comments about broodiness, so we can address that real quick.
Yeah, I mean, I think the easiest way here, and it's not, obviously hens become broody and there's nothing we can do about it, but removing the eggs daily, often, so that just stimulation to sit on those eggs is not there. That's going to be the easiest one, right? And then when they do go broody, there's plenty of, I don't know about all of them, but the suggestions online, we want to cool, right? You can sort of break her or try to break that broodiness by, ideally putting them on wire isn't great, but to cool that breast down, because they start to lose those breast feathers so that they can incubate those eggs. So if we put air across that and cool them down, that can be one method to break them. But yeah, you're right. I mean, they're going to go off feed for the most part, right? They're going to stay on that nest. And so over time, while they do build the resources to do that, they don't last forever. And so they will, decline in health over time. So if they don't come off the nest, if they don't break that, then we need to kind of intervene and prevent it from happening.
Yeah, my silkies are just they're such a different chicken. If I broody break one of my Orpingtons or my Wyandottes, they get it, and in a few days they're like, okay, I'll go back to laying eggs. The silkies, you broody break them, and you think they're broken, and then 2 days later they're like, I really want to hatch eggs. They just love it. So oftentimes what I do is I go out in the afternoon and collect the eggs for the day, and then I close my coop off to them, open up the run, and I'm like, go forage, and they usually do. They tend to squawk about it a lot. So if I can't broody break them, that's what I do. I just force them to leave and block off their nesting area because they're just a different breed of chicken. Yeah. Don't expect a lot of eggs from a silky.
No, that's a great idea.
Yeah. Okay. We were talking about something else and I got lost from a question. Oh, someone said, new hatcher here. Is inbreeding chickens okay? Like a rooster having babies with his own offspring?
Yeah, I mean, I think that's relatively common, but you can only do that so many times and things start to go downhill. I mean, obviously it's common, like some of these weird varieties, I call them weird, but unique varieties of birds. There's ways that they got that way, and inbreeding is one of them. So, nothing against the Silkies, but there's probably some, if we go back in the line, if you're going to do it over and over and over again across multiple generations, probably not a good thing.
Yeah.
Hybrid vigor is a real thing, and so the more you inbreed, the less capable, like from immune system wise and everything else, those things start to go downhill. So it's always
Okay.
good to introduce new genetics into a line.
Of course, I picked the sunniest spot on my porch, and I can't see what I'm doing here. I'm gonna grab my hen out here in a second. Is there any other common reproductive issue that you're like, hey, we didn't talk about this one yet?
You know, I get a lot about lash eggs. We see that all the time, right? So that's probably one that's worth talking about. Can be caused by a number of reasons. Probably infectious would be probably at the top of the list, but it's not always, that's not always the case. And if it's infectious, there are bacterial and viral things that cause lash eggs too. So really, what that is, to start to describe it, is just like really most infectious processes in chickens, they don't form pus, right? So it's the immune system kind of just tries to wall things off, and that's what happens here. Is that now it's happening within the reproductive tract. These cells are being shed into the reproductive tract, and essentially just a mass of cellular debris.
Right.
And eventually that passes, hopefully. I mean, not always, and that can, this egg-bound hen can be really not just an egg in there, but it can be this massive cellular debris. We want to get that out. The thing is not to be too concerned with it if she passes it. Obviously, if it's happening again and again and again, we may need to intervene with antibiotics. But I know I read a lot on the forums that, she had a lash egg, we have to put her on antibiotics. That's not really the right approach. If it's something that's happening continually over the course of weeks, yeah, potentially we need to intervene with some medication. But as most things, we don't just jump straight to put her on antibiotics. So don't be too concerned about it too. A lot of handle it with gloves. Don't touch it. It's like some kind of nuclear object or something, like we can't touch it at all. It's it could be bacterially contaminated, but I mean, so could a lot of other things in the coop. I wouldn't be too scared of it. I mean, I wouldn't.
Yeah.
Gloves for touching anything is not a bad thing, but
right.
it's not like this infectious mass that's going to like spread to the rest of the flock either. That's what I
would. So if you have a lash egg, be aware of it. And you can't, I mean, I've got 40 chickens in one coop, and if I find a lash egg, there's really no way to know who laid it, right? You're just kind of like, okay, well, I can guess. If I have a camera in there, I can maybe, break it down and figure out who it could be. But you don't have any secret tips, right? No secret way to know. Look at their rear end.
No, well, yeah, I wish. But we see them all the time. Like I was talking to a client the other day, like that a limb had fallen on the coop, and that obviously stresses birds out. So that, all of a sudden there was like a lash egg the next or a couple days later.
Yeah.
And I'm like, it's a great example of this is not an infectious process. That bird was stressed out, probably had just started to lay or come into production when that happened, and just kind of seized up, right? Just the stress of that event kind of halted the reproductive tract. And so now that start of the eggshell just kind of sits there and it just builds on itself. And then finally she was able to pass it. That doesn't mean we need to go put her on antibiotics, right? That was a great example of stress that just caused it too. So nothing to worry about. I do see, it's kind of shifting gears a little bit to another subject, but is, when a hen is like prolapsed, or there's an egg in the tract that she's trying to get out, being egg bound, could be a number of things, like a broken egg in the tract where she's just trying to get that shell out. That's one where we can intervene. If you see her straining, right, trying to get that out, it's always best to try, like if you see a little bit of material in there, to try to get that out. And the other key thing to that too is, again, going back to mammal medicine, right? Like even I've got 3 kids, so I've seen this happen, but like the placenta in a mammal, right? They always want to make sure that it's all there. And so you'll see, they'll actually look to see if the whole placenta is there, right? Because if it's not missing, or I mean, if something is missing, that means it's still inside. We need to go get it, because that's that could be an infectious nidus, right? For something. And same thing goes with if you remove some shell debris that's coming out, she's straining and trying to get it out. The best thing to do is kind of, in your mind, put it back together. It's like, hey, is everything here, or am I still missing something? Right. If you're missing like a significant part of it, that means there's most likely it's still in there, and we need to isolate her. I would say, read the forums, in a dark spot, where it's warm and she's comfortable and it's quiet, and just kind of leave her be. That's the best thing don't intervene with baths and all the other things
Yeah.
that just increases stress. What we want to do is decrease stress as much as possible.
Yeah, and that's something we learned from you earlier in this series. We talked about Epsom salt baths. So if you haven't seen that episode, kind of go back a few and watch our old episodes. They're all saved in my highlight. It's called Purely Vetted. It's a little circle bubble on my main page, and you can see our past episodes. And we did talk about Epsom salt baths in the past. So I see a lot of people will send me pictures and videos of their chicken, and I think my chicken's egg bound. She's been like this for a week. And she's walking like a penguin, because when you Google my chicken's walking like a penguin, the first thing that comes up most likely is she's egg bound. And then everybody does all the steps that Google tells them to do, or the forums tell them to do, and nothing's coming out, and they're still walking like a penguin. I would say, if I had to guess, 8 times out of 10, when somebody sends me that, it's not egg bound. There's no egg in there. It's something else going on. And I think I sent you pictures, sent you a text message one time and said, I just cut open my chicken who had passed away, and give me your thoughts on what this is. And she just had a huge, massive softball-sized tumor in her abdomen. And she was walking like a penguin. She was doing the labored breathing. And I thought maybe she's egg bound. And then I came home about 2 hours after that, and she had already passed. So I thought, oh gosh, she was egg bound and she passed right away. And then when we opened her up, we realized it was not her being egg bound. She actually had a big, nice sized tumor inside of her.
Totally. And you know, that's we didn't do the histo, like, you know, diagnostic confirmation of that's what that particular tumor was from. We can assume that's most likely the case, but you know, that's a great example of, you know, Marek's doesn't always present like classically when you see the leg stretched out to the back or the droopy wing. It has many different presentations, right? And that in that particular case, there were tumors in the abdomen. They were space occupying, and yeah, it looked like she was egg bound. It was the size of an egg, but it was a tumor. So just to, you know, that's another example of you can't fix everything.
Right. Yeah, and it's hard to know. And as backyard chicken keepers, we don't have access a lot of times to a vet, or it's just not accessible for some people. And so, you know, you see a penguin walking chicken, and that's, you know, what you try. And then it's not that. You know, I was like, gosh, I do something wrong, but it happens so quick, you know, and a lot of people beat themselves up like, gosh, I should know what to do. Or, you know, we are not vets, most people that have backyard chickens. And if you aren't going to go to a vet for imaging and things like that, then it's just really hard to know. And sorry, there's a nice airplane going across my house right now. It's probably really loud on camera.
No, that's good. Can't hear.
But yeah, I feel like people, you know, even if you do have a chicken who has, you know, a nice big tumor inside, and you do take her to the vet and they do imaging, you know, sometimes there's just really not feasible ways to handle that. So, you know, a lot of times people will say, okay, well, I just ended up putting my chicken to sleep. And I think that's a fair way to handle it, especially when, you know, chickens, in my experience, don't do well during surgery. And so, you know, anyway, that was kind of a tangent I went off on there.
Yeah, no. I mean, that's an important thing too. Is that well, we can't do much with those, right? I mean, that's again guarded prognosis. You're not going to really get over those tumors. It's a systemic thing. It's not like it's one tumor. It's really all over her body.
Yeah.
That was the one causing the issue.
Right. All right, I'm gonna grab my chicken out of this cage because she's getting mad at me. And hopefully she doesn't take off and go back to her flock. Come here, girl. Oh, good. You pooped in there too. All right, so I'll give you a little bit of background. This is Sarah. And a lot of my followers know them because I had 3 of them I rescued one time. They were dumped off in an auto shop. And so I found them, or somebody called me and they were like, there's 3 chickens under these cars living outside. They were missing most of their feathers. We named them the Sanderson sisters. And you can tell they're just a production hen. And this is the last one I have. The other 2 had passed away already. I've had her for a few years now. And you can see she's kind of got the labored breathing going on, and her back end's pretty swollen. So let me see if I can. I mean, she's heavy. Like right now, she's heavy. She's pretty swollen. Let's see if I can show you. Okay, this all right here. It's kind of hard to see on camera, but this just feels like one big. Watch her poop on me. One big water balloon. Like it is. I'm not feeling any like hard lumps. There's no egg, you know, material in there that I can feel. It just feels like a super stiff water balloon to me.
Water balloon. Yeah.
Yep.
Yeah, great example, here of probably one that would benefit from being drained, right? So draining that abdomen or cyst in this case. We hope it's the cyst, right?
Yeah.
You really don't know until you actually begin that draining process, and that color is going to be really indicative on what
Yeah.
the prognosis is going to be. So, yeah, we can. Maybe not. We're not going to do it live, but you can show us draining her later.
Yeah,
Um,
I have all the stuff to do it. I kind of wanted to show everybody her first, and then I will do a video. I'll do her draining this weekend, and I'll
and this
record
is
it for
one
you guys and probably get blocked on Instagram.
one good
Say
thing,
hi.
or one thing I wanted to mention too is you picking up her, you handling her. You kind of know. I always tell people when you handle your hens, do that kind of palpate the abdomen, figure out what normal feels like. Don't always
Yeah,
when there's something wrong and then you try to palpate and figure out what's going on. That's abnormal. It's always best to learn what normal feels like first. So when you're
yeah,
palpating the abdomen, you should easily feel the gizzard. That's totally normal. It's going to be right kind of at the bottom of the ribs. You should feel like a golf ball or something a little larger in there. That's
yeah,
normal, right? That's not an egg. If she's in production, you may feel an egg in there a little bit more, but obviously be gentle. But always be feeling on your birds. Like when I mention condition a lot, I ask people, well, what's the condition of the bird? What I'm referring to is like muscle condition, body condition. And so, the muscling on her breast is, depending on what variety it is, right? If you're talking about leghorn, there's really not much, if anything, there, but there's still muscle on the breast. The
mhm,
larger varieties, they'll have definitely more breast muscle, but as they get sicker, the bird really starts to, and she's not eating, they'll
yeah,
start to consume. First, they'll consume the fat, and then they'll start consuming, breaking down that muscle. And when you feel that, then there's really something going on. You want to jump in front of it as fast as possible, and that helps
yeah.
with weight too. Weight can tell you that as well.
Yeah, for sure. You can, I don't know if you can see on screen there, but she's kind of gasping, and maybe she's stressed out because I had her in the cage too, but she does this periodically. And I'm picking her up today. She feels significantly heavier than she did 2 days ago when I picked her up. So I can tell she's pretty swollen. So we will do some draining. Somebody asked, is there thanks for joining. Someone said they had to leave. Is there an amount to stop at if you're draining the fluid? I've seen a lot of stuff saying don't drain too much, obviously, because you don't want to put them into shock. Is that all correct?
No, it's not. I mean, it depends on what we're talking about, but in terms of just volume, that's space occupied by fluid. And so you're not like taking anything out of the circulatory system or
Okay.
anything like that. So I place the needle and I let it drain for as long as it wants to
Okay.
come out. Usually be a couple minutes or so, and obviously try to keep her calm and steady as possible. She does have a needle inside of her, so
Right.
that's important. But I do not like suggest only take out so many mils of fluid, because one, the more we go in and out, like if we're gonna, okay, I want to take 20 mils of fluid out today, I'll take another 20 out tomorrow. Every time you go in there, you risk introducing bacteria, right? And so if we get
Okay.
bacteria into the abdomen, that's a whole nother problem.
Yeah.
And so limiting the number of times that you drain her is going to be the most ideal thing, right? Don't worry about some kind of going into shock from a loss of fluid.
Okay. Okay. That's good because everywhere online gives that warning. So that's nice to know from the poultry doc source that
Yeah.
it's
I
okay to
mean,
drain. And I'm thinking what it's like, what is it, like 50 cc's people recommend? And I'm feeling her right now and I'm like, there's a lot more than that in there. I
right,
don't
right.
think that's gonna do much for her comfort level. So
Yep.
um
The more of that fluid you get out, the better she's going to be able to breathe, right? And so that right
yeah,
there is going to help her tremendously.
right. This is totally a different topic here, but someone said hatching my own chicks, what should I do about Marek's vaccine? And you definitely can buy that. We talked about that, I think, maybe 1 or 2 episodes ago. But you
Hmm.
can buy that vaccine and you can administer that yourself. Um, so you can check that out. There's lots of sources online for that, right, Sarah? I'm gonna put her down because she wants to go back to her flock after she flaps her wings. There you go, girl. Thanks for not pooping on me, Sarah. Great job. um, so yeah, okay. What else? Is there anything else that we haven't talked about? And somebody was asking about um, eggs. They had a soft shell egg question, and then somebody else asked about little fairy eggs. Their chicken was laying
Right.
a lot of little fairy eggs often. So no yolk, tiny little eggs.
Yeah.
Um,
Yeah, that can be caused, you've got sort of something drops into the tract, could be a piece of cell or anything, and it really starts to stimulate that egg production process. So that's what those come from, right? There's something falls in, and basically the shell starts to form, the egg starts to form, but there's no yolk there. So a lot of times those birds may probably be out of production, and there's just something there that's stimulating it. So no
Hmm.
specific cause to it, no rhyme or reason.
Yeah.
Um, oh, the other one that you mentioned, what was it?
Fairy eggs.
Well, yeah, those are fairy eggs, and
Oh, is that what you're
then
talking about? Oh, soft shell, soft shell.
oh yeah, the soft shell. I've been getting a lot of questions about soft shell eggs recently too. So
Hmm.
a number of things, right? So could be anything like from a traumatic experience that made that egg go through the tract faster and just didn't put the calcium on. Could be a calcium issue. Often, if you've got normal eggs and then all of a sudden one day you find soft shell eggs, that's typically not a calcium problem. Like calcium, the skeleton is really like the reservoir for calcium in a bird. And so as she needs calcium for that egg, there's a cellular process that pulls calcium out of the bone and then deposits it, or basically mobilizes it, sends it to the reproductive tract, and then the reproductive tract puts it down on the egg.
Okay.
And when she eats calcium during the day, it gets put back into the bone. So the skeleton serves as like this sponge, right, for calcium. Now, if you get slowly over time, your eggs are getting softer and softer, or shells are getting softer and softer. Yeah, potentially there's a lack of calcium there. We need to fix that. Really, it's a couple things that are going to be the most likely. One is there's a couple diseases that will cause this, you know, egg drop syndrome or EDS is a big one. Kind of depends on where you're at. Common within backyard flocks. It's a virus. There's really nothing we can do about it. Birds will recover, so we'll have a period of soft shell eggs. They'll return back to normal production. Maybe not at the same level because they've been affected by this virus, but they will return. Mycoplasma can do it. Infectious bronchitis, which is a respiratory disease, a respiratory virus, actually can affect the reproductive tract as well too. So, you
Hmm.
know, and both of those viruses can cause um, the lash eggs that we talked about because there's an infectious process inside the reproductive tract. Those shells are being or cells are being shed and
Okay.
can start those lash eggs too. So there's a number of things. Calcium is definitely, if you've got plenty of calcium out there, if you're feeding a layered diet that's already has, that 3 or 4% calcium in the feed,
Hmm.
calcium is likely not the issue. So I would
Okay.
kind of aim your focus at something else to try to figure out what exactly is going on. And then lastly, there's hens just have soft shell eggs sometimes. It's a fluke. It happens. I mean, we had, when our birds were coming into production this year, we had a few soft shell eggs, and Rachel's all worried about it. I'm like, they're just kind of figuring things out. They're coming into production. It's springtime. I'm
Yeah.
not too concerned about it. They're all fine now. I haven't seen one in a couple weeks. So
Yeah,
good.
I usually notice it in new layers. Now, Sarah, the one we were just looking at, she had a soft shell egg that was emptied out and it was kind of hanging. And she also
Mhm.
had a vent prolapse at the same time. So I treated that, got her taken care of. And that was about 2 months ago. And now we're dealing with this issue. So I can probably say it was probably a symptom of what she has going on now, is my guess.
Yeah. Yeah, and it
Um,
goes back to that space occupying. She can't pass that egg very well because of what's going on inside of her
yeah,
in terms of like just the space occupying mass of that cyst. So,
right. A
prolapse is
few,
another one we haven't talked about. So,
oh, yeah. Oh wait,
um,
before we move on, I want to
yeah,
show
yeah.
you the big. So I don't know if you guys can see the little spots on here, but there's just these deposits on the outside of my shell, and not sure which hen it is because I have a few that lay this type of egg. So I haven't yet caught the culprit, but she's been doing this now since the beginning of spring when she started laying with just all these little bumpy I'm guessing calcium deposits on the outside of her egg. Um, and somebody else asked about that too. So do you want to share any insider knowledge about that?
Well, other than that, they're calcium deposits. I don't know if we can influence, their, what they come from, if it's too much calcium or not. I think it's
Mhm.
just sometimes it's just flukes of the reproductive tract, and that's what they're laying down.
Yeah.
I don't think there's any particular thing that anybody's doing to cause it. It's just kind of one of those flukes.
And I think we're so used to, if you're new to backyard chickens or new to farm life, we're so used to seeing perfect eggs in a carton at the grocery store. And we don't see any of the weird ones, right? Because they're not going to sell those to us. And so I think people are just so thrown off. I had a really long egg or I had a fairy egg. Well, yeah, that is surprising if you've never seen that kind of thing before. Once you start having chickens, they have all sorts of weird stuff going going on that you're not going to see, from eggs in the grocery store. I think so. We have to keep that in mind. Things just happen. Flukes just happen sometimes, and unless it's like a repeat problem or something that's causing other issues, be aware of it, but no freaking out.
Yeah, that's totally true. And another thing to mention there too are meat spots. A lot of people, or blood spots, well, people call them, they go by different names, but those are, you rarely see those in a carton of eggs that you buy from the store because they are removed, right? Just like the ones that are too large or the ones that are too small, you buy specific amounts of eggs. Nikki, I don't know if I lost you or not, but I'll keep going. So you buy those eggs and the meat spots or the blood spots are removed. Basically what's happening there is, I can't see Nikki, or I can see you, Nikki, but you're paused, so I'll just keep going. But when that ova is right before it's released into that infundibulum that we talked about earlier, there's a layer of blood vessels that are like feeding it so it can grow. And what happens is right before it begins to be dropped into that infundibulum, those blood vessels split. They form this perfect like line. You can actually see it at necropsy. So you have all these tiny little capillaries, and you'll see a division. And so then it opens up like the little glove that's holding it, and then releases it into the infundibulum. So, okay, you can hear me. Yeah, you're just a frozen screen, but so yeah, it's called the vitelline membrane. And so it opens up and releases the ova. Well, when it opens up, sometimes there's a few of those capillaries or capillary or two that may have remained, and it opens and one of those capillaries is broken, and we get a little deposit of blood on the egg yolk. I mean, there's really nothing unsafe about it. Actually, all those eggs that are found that way commercially, they go to what we call the breakers. And so if you're buying like egg product, like powdered eggs or whatever, those are all coming from
on blocking a very inappropriate comment, of course, and then it just like froze my screen, and I could hear, but I couldn't see, and then just disappeared. Okay, you're back. Keep going. Sorry about that.
No, I don't know where I don't know. I was just talking to a blank screen. I was thinking because I saw the comments kept coming, so I was like, "Oh, I guess somebody can hear me."
Yeah, I could hear you, and then all of a sudden it just disappeared. So sorry about that. That's my fault.
No worries. I don't know if I think everybody heard, but so like the ova, so before it actually goes and drops into the infundibulum and starts becoming an egg, there's these thin layer of capillaries that surround it that are actually feeding it, and that's what's putting the energy and building the yolk into it. And right before it's going to be released, those capillaries divide, and it's actually really cool. You can see this at necropsy. You'll see all these little capillaries around the ova, the yolk, and then there's a perfectly clean line. I mean, it's perfectly straight right down the middle, and that's going to be the spot that opens up. Basically, that little membrane opens, and the egg yolk falls into the infundibulum. Sometimes there is a break. Some of those vessels don't completely split, and you'll get a little blood spot on the egg yolk. There's nothing wrong with it. I mean, unless it's just nasty. I don't ignore them. I don't throw them away or feed them to the chickens or whatever. So those are all removed. I mentioned that earlier, but like commercially, they would be removed. There's nothing wrong with them from a food safety standpoint. They're still included in those egg products that are produced, like carton eggs and powdered eggs and stuff like that. So
okay, and you're talking about meat spots, right?
Yeah, meat spots, okay. Blood spots. Yeah, they go by number.
Okay. Yeah. Okay, sorry, because I was just too focused on figuring out how to get myself back on here. Okay, let me see if we missed any questions here. All right, so we talked about fairy eggs, talked about spots inside the eggs. Trying to think what else. We talked about soft-shelled eggs.
We were talking about prolapse.
Oh, that's right.
Yeah. So obviously that's one that we see a lot of, right? So if you see that chicken with the prolapse event, obviously we want to get on it early, right? The sooner we can find it, the better. We want to prevent it from drying out. So I suggest, if you do find it, the best thing you can do in the short term is apply some sort of water-based lubricant to keep it from drying out, because that's really sensitive tissue. Then we want to try to get it back in place, or actually really want to figure out, is the egg still in there, or is this, post egg being laid and just the resulting trauma from it? If you can confirm that the egg's gone and there's nothing left in there, then the goal is to get it back, right? Get the tissue back in place. And so gloved fingers, usually 2 fingers to try to replace that or get it back in place. And you're probably going to need to put pressure on it for a while, several minutes, because she's going to want to continue to push because she thinks it's still out there and that's swollen. If it continues to happen again, we've talked about Manuka honey in the past, like medical grade Manuka honey, where in place of that, just like straight sugar works too. What we're trying to do is pull the fluid out of that swollen tissue.
Okay.
And sugar can do that. And we want to, again, put pressure on it, keep it in place. This goes back to after that, keep her in a really comfy, stress-free, dark place and keep her isolated. Obviously, you want to check on her every now and then just to make sure that it's not reprolapsed again.
Yeah.
If it continues to prolapse again, then really veterinary intervention would be involved, and a vet can place stay sutures. So basically like 2 sutures, usually on either side of the vent, keep things closed up. And obviously that's not going to help if she goes to try to lay an egg again. Now she can't get around that, right? And a lot of times those sutures can tear out. So in a worst case scenario, like emergency situation, and you really need 24 hours of recovery time. And again, I say this is an emergency, something you wouldn't do often, but you can restrict her water, basically remove the water for 24 hours.
Okay.
A hen will not lay an egg if she's got water, right? She'll take that energy and water and put it towards survival rather than laying an egg. So it will shut down reproduction. And that may give you enough time, or may give her enough time to let those tissues kind of heal, slow or stop egg production so we don't have another traumatic episode. And then, obviously no longer than 24 hours to restrict that water.
Yeah.
I mean, if she's still having issues, then really that's a point where a veterinarian needs to get involved.
What about restricting light? That's usually what I do to try to stop the egg production.
Yeah, that warm, going back to the warm, dark spot. When I say dark,
you said dark. Yeah.
But they will still, like, it's not like a light switch on and off. I mean, she's still going to have that stimulation to lay. It will slow things down, but it's not going to be as immediate as restricting water. So
I feel like a lot of times when they're in a trauma state like that, they tend not to lay an egg anyway. Anytime I've dealt with a prolapse, and I don't have a lot of them here, but I have a lot of friends in the area with chickens, and I'm the one they turn to when they don't want to put their fingers in a chicken vent. Like, I tell people, like, if you don't have chicken friends who are willing to do it, you need to learn to do that.
Yeah, it happens. It happens. And sometimes too, you may need to go in with your, the digital exam and try to figure out where that egg is. Because if there is an egg in, the better side of this is the egg's out, and now we have to just figure out how to get it back. If there's still an egg in there and she's egg bound, sometimes you can feel that egg and sort of manipulate it out, obviously working from the outside with a finger in the vent, trying to find where that egg is at. Remember, the reproductive tract is about 8 to 12 inches long, kind of depends. So depending on where that egg is, there's a good chance you probably won't be able to get to it. But if it's right there at the end, you can help that way.
Somebody keeps asking about parasites. I just wanted to say we're not ignoring you. We did talk about parasites in a previous episode. All of our previous episodes are saved in my highlight called Purely Vetted, and you can find them all there. They're all well labeled. I'm worried about this episode because the first half of it got cut off. So we might have to put some information later in the comments about the stuff we talked about so people can look through there. Just to see. But we showed earlier in the video my chicken who appears to maybe have some water belly going on, and we talked about how to treat that. So I'm going to do a video follow-up and drain that for her, and then I will post that too. So if you are just joining on this part of the live, we did that in the first part of the live, and we talked about all sorts of stuff. I did see a question about vent gleet, and somebody was saying, I feed my chickens well, they get good water, like why is their back end dirty?
Yeah, so not so much a reproductive issue, right? It's all coming out of the same place. But and there's not a specific reason why. So vent gleet is basically, and I see this referred to a lot, there's just pasty vent, and it's a vent gleet. Everything's referred to as vent gleet. Not everything, but too many things are. Vent gleet is essentially urate weeping. So it's actually the kidneys continually excreting urates. And so we see this urate weeping syndrome. And so you'll see white running down the hind end of the chicken. One, it's caustic, right? So usually that skin there is inflamed because it's really basic and it's causing irritation on the skin. There are a number of things that we think can cause it. It's not fungal. I see so many times about, putting monostat on it. Monostat. I mean, I wrote this article. I don't know if I told you what sees more monostat, vents or vaginas. so I'll release that one here soon. But anyway,
I don't know if we're allowed to say that on Instagram. I guess we're going to find out.
I'm a doctor.
That's true. It's true. Okay.
Anyway, back to the thing. Calcium can sometimes cause it as well. Obviously, the kidneys are trying to excrete a lot of things. So this is one where I wouldn't suggest vitamins or anything else that has to make the kidneys work even harder. To be completely honest, even commercially, this happens, and we see it like it'll roll into a flock. It's most likely associated with something infectious, and things have been pulled out of it. But in medicine, we try to do what we call fulfill Koch's postulates, where we think it's something, we take that something, we put it in a bird and try to reproduce it, and then take it and find it again, and that really hasn't been done yet. So could be nutritional, could be infectious. There's really, we think there's a lot of things that contribute to it. Yeast is probably not one of them.
Okay. So when, not necessarily vent gleet, but you see other stuff coming out of the back of your chicken, like egg yolk material, then that would be more, oh, sorry, I got a notification. That would be more like the egg yolk peritonitis kind of a thing, maybe to look out for.
Yeah. So the egg yolk peritonitis, you're not going to see that coming out of the hind end, right? Because that's inside the abdomen. That's a process that's going on inside. So basically, if I'm finding, egg yolk material that's on the back end of the chicken, she's dirty, she's got yolk material. If it's soft shell egg issue,
broken egg inside.
Hopefully she got the shell out or whatever the remnants of that shell was. But that's one you definitely want to keep an eye out for, because you see her straining. We can assume that probably there's still some of that shell material in there. So we want to keep an eye on her, keep an eye out for that prolapse, and potentially help her get that shell out, especially if you see just a little bit of it coming out. We want to try to pull that out of there for her.
Okay. Okay. I don't see any more reproductive questions. Is there anything you had in your notes that we didn't cover?
I mean, I think we hit the high points, everything that I had thought about.
Okay, awesome. Sorry for the confusion there with the
no worries.
Stop live.
Yeah, we'll post this too, and Rachel do her magic and put them together to make it all look like one. So
okay,
get that
perfect. All right, great. Well, thank you for joining us. We've been here for quite some time, almost an hour today. So I appreciate you being here with our followers to talk about reproductive stuff. And we are looking for suggestions for next month. So we've already talked about a lot of things. So go check out that highlight if you want to watch old episodes. And we're doing one a month. We try to do the first week of the month sometime in there. So join us next month, and we will talk to you guys soon.
Yeah. Thanks, everybody.
All right. Thanks, Dr. Blayne. Have a good one.
You're welcome. You have a good weekend. Bye.